Group of grandparents in Massachusetts are now eligible for COVID-19 vaccines. And here to answer your questions is Dr. Rick Malley, an infectious disease specialist at Boston Children's Hospital. Thanks for being here.
My pleasure.
All right, so this is the first question that I think every family is asking now. If my parents get both of their shots in the next month, how long do they have to wait before they can safely hug my kids?
Well, yeah, that's a very important question that we are all debating right now. What we know is that even after the first dose, but especially after the second dose, there is a very much reduced risk, even in elderly patients, of getting mild to moderate disease, and probably also a very much reduced risk of getting severely ill. What we don't know is the extent to which this will mean that individuals who've been vaccinated can actually safely interact with one another without spreading the virus. And so while the grandparents might be safer, shall we say, from getting the disease because they've been vaccinated, what we don't know yet is whether they could inadvertently transmit the virus to another person, such as their grandkids, and then result in more spread. So for now, unfortunately, while it is very reassuring that a grandparent has been vaccinated and is at much lower risk of getting sick from this disease, we really can't tell these grandparents that they can get rid of the masks and hug their grandkids just yet.
All right, but at least we know, right? We have that answer at least. A lot of folks thinking about summer, especially on a day like today. What's your advice to parents who might be looking at day camps right now?
I think there's every reason to be optimistic that with the vaccination campaign ramping up in Massachusetts, with more and more people getting vaccinated, we should start seeing, as we have seen already in Israel, for example, and in the United Kingdom, that the disease rates are dropping. And once we see that as a result of vaccination and all the other good measures that people are taking of social distancing, of wearing masks, of avoiding being indoors, then I hope that what we'll see is the number of cases in Massachusetts will really start plummeting. At that point, the idea of summer being slightly closer to normal is really much more likely. And I think as parents start thinking about their summer, they can look at the rates of disease, the rates of positive tests that we have in Massachusetts. And if, as I hope, those numbers really continue to improve and go in the right direction, then I think we can start thinking about having a slightly more normal summer.
All right. Thank you so much, Dr. Malley, for your time. We truly appreciate it. I think a lot of parents really were hoping for that insight today, so thank you.
It's all